Bradycardia is a cardiovascular medical condition. Look at this ECG findings. Slow heart rate, and echocardiogram. Look at this. A detail going on. Introduction. Bradycardia is a medical condition characterized by a slower than normal heart rate. In adult, a resting heart rate below 60 beats per minute is typically considered bradycardia. While it can be a normal finding in healthy individuals, such as athletes, it may also indicate an underlying pathological condition requiring medical attention. Definition. Bradycardia is defined as a heart rate of fewer than 60 beats per minute in an adult. However, the clinical significance depends on the individual's symptoms and overall health. Etymology. The term bradycardia derives from the Greek word bradys, meaning slow, and cardia, meaning heart. It refers to a slower than normal heart rate, typically defined as fewer than 60 beats per minute in adults. Types. 1. Sinus bradycardia, slowing of the sinus nodes impulse rate. 2. Sick sinus syndrome, dysfunction of the sinus node leading to irregular heart rhythms. 3. Heart block, impaired conduction between the atria and ventricles, classified as first degree, second degree, type 1 and type 2, third degree, complete block. 4. Reflex bradycardia, caused by stimulation of the vagus nerve. 5. Drug induced bradycardia, resulting from medications like beta blockers or calcium channel blockers. Causes. Intrinsic factors. 1. Aging. 2. Sick sinus syndrome. 3. Congenital heart defects. Extrinsic factors. 1. Hypothyroidism. 2. Electrolyte imbalances. 3. Medication effects. 4. Sleep apnea. 5. Infection. 6. Myocardial infarction. Risk factors: 1. Age, common in older adults. 2. Existing heart disease. 3. Electrolyte imbalances. 4. Use of certain medications. 5. Sleep apnea. Complications: 1. Fatigue and dizziness. 2. Syncope, fainting. 3. Heart failure. 4. Sudden cardiac arrest. Pathophysiology: bradycardia occurs when there is an alteration in the normal electrical conduction system of the heart. This can result from 1. Decreased automaticity of the sinoatrial node. 2. Blocked conduction within the atrioventricular node or bundle branches. 3. Increased parasympathetic tone. Pathophysiology of bradycardia step-by-step process. First step: reduced impulse generation. Bradycardia occur when the heart's pacemaker, the sinoatrial node, generates electrical impulses at a slower rate than normal. This may result from intrinsic dysfunction of the SA node or external influences such as medications or vagal stimulation. 2. Impulse conduction delay. Abnormalities in the conduction system such as blockages in the atrioventricular nodes or his Purkinje system can slow or interrupt the transmission of electrical signals to the ventricles. 3. Autonomic nervous system imbalance. Excessive parasympathetic stimulation or reduced sympathetic activity can decrease heart rate. Conditions such as vasovagal syncope or sleep apnea can exacerbate this mechanism. For ion channel dysregulation, alterations in ion channel function, particularly affecting sodium, potassium, or calcium channels, can impair the generation or propagation of action potentials in the cardiac conduction system. 5. Structural or ischemic damage. Myocardial damage from ischemia, infarction, or fibrosis can impair the electrical conduction pathways or the SA nodes function. 6. Secondary influences. External factors such as electrolyte imbalances, hypoxia, hypothyroidism, drug effects can contribute to the bradycardia. 7. Resultant hemodynamic changes. A slower heart rate may reduce cardiac output if compensatory mechanisms such as increased stroke volume do not suffice. This can lead to symptoms such as fatigue, dizziness, syncope, or even heart failure in severe cases. 8. Adaptation or compensation. In some individuals, bradycardia can be a physiological adaptation with no adverse effects due to an enhanced stroke value and overall cardiac efficiency. This sequence highlights the mechanisms underlying bradycardia, which can vary based on the specific etiology and clinical context. Signs and symptoms: 1. Fatigue, 2. Dizziness or lightheadedness, 3. Shortness of breath, 4. Chest pain, 5. Confusion or memory problems, 6. Exercise intolerance, 7. Syncope. Diagnosis: 1. Medical history and physical examination. Identify symptoms and contributing factors. 2. Electrocardiogram (ECG), key diagnostic tool to identify bradycardia and its types. 3. Holter monitoring, continuous ECG monitoring over 24 to 48 hours. 4. Event monitoring for intermittent symptoms. 5. Echocardiogram, access structural heart problems. 6. Blood test, evaluate for electrolyte imbalances, thyroid dysfunction, or infection. Nursing diagnosis: 1. Decreased cardiac output related to altered heart rhythm. 2. Activity intolerance related to reduced oxygen supply to tissues. 3. Risk for falls related to dizziness and syncope. 4. Anxiety related to fear of health complications. 5. Knowledge deficit regarding the condition and its management. Disease management. First, medical management. 1. Address underlying causes, treat electrolyte imbalances, hypothyroidism, or infections. 2. Medication adjustments. Discontinue or modify medications causing bradycardia. 3. Temporary pacing for acute and severe cases. 4. Permanent pacemaker for chronic systematic bradycardia. Nursing management: 1. Monitor vital signs, regularly assess heart rate and blood pressure. 2. ECG monitoring, detect rhythm abnormalities. 3. Education provide information about lifestyle modifications, medication adherence, and when to seek help. 4. Fall prevention address safety measures for prevent with dizziness or syncope. 5. Psychosocial support address emotional concerns and reduce anxiety. Treatment options: 1. Lifestyle modifications, regular physical activity, adequate hydration and balanced diet, avoidance of excessive alcohol and caffeine. 2. Medications: atropine for acute symptomatic bradycardia, isoprotrinol. 3. Pacemaker implantation for chronic and symptomatic bradycardia. 4. Management of underlying conditions such as thyroid disorders or electrolyte imbalances. Psychosocial medicine: 1. Counseling to address fears and anxieties. 2. Support groups provide community and shared experiences. 3. Stress management techniques, relaxation exercises and mindfulness. 4. Family education involves family in understanding the condition and management strategies. 5. Therapeutic communication foster a supportive environment for expressing concerns. Prevention: 1. Regular health checkups. 2. Early treatment of contributing conditions. 3. Avoiding excessive use of medications that lower heart rate. 4. Healthy lifestyle practices including regular exercise and balanced nutrition. In conclusion, bradycardia can range from benign condition to life-threatening disorder. Early recognition, appropriate diagnosis, and effective management are crucial in mitigating complications. Nurses play a critical role in patient education, monitoring, and psychosocial support, ensuring comprehensive care and improve quality of life. Thank you. Have a nice day.